Hello everyone, this is Dr. Madhusudan Rao and the program I teach medical students. Today we are going to touch upon the topic that is cyanotic spell. Cyanotic spell is a medical emergency in the patients with tetralogy of Fallot. This is also called hypoxic spell or paroxysmal hypercyanotic spell. It's also called a TET spell. Well, look at this picture. This is the picture showing the four components of the tetralogy of Fallot. That is right ventricular outflow obstruction, that is pulmonary stenosis, large ventricular septal defect, overriding of the aorta communicating with both the ventricles. Overriding occurs over the ventricular septal defect. And there is hypertrophy of the right ventricle. Okay. And severity of the tetralogy of Fallot is determined by the degree of obstruction to the right ventricular outflow tract. In milder forms of tetralogy of Fallot, otherwise called pink Fallot, it is these children with the milder form are more prone for cyanotic spell. And during these spells, there is sudden and striking decrease in the oxygen saturation due to the obstruction to the right ventricular outflow tract. Okay. As I told you, children with the milder form of the tetralogy Fallot, that is pink Fallot, they are more prone for this complication because they do not develop the that is a compensating mechanism in the form of polycythemia. So they are more prone for, they are not prepared for the degree of hypoxemia. So they are more prone for this particular complication. The important factors that trigger this particular situation are dehydration and agitation. And this is associated with the hypoxia, metabolic acidosis, that results in the clinical features and complications associated with the cardiac dysfunction, circulatory collapse, sometimes death. The two important components of this particular cyanotic spell are pulmonary vasoconstriction and systemic vasodilatation. Okay. Children with tetralogy Fallot with milder form of cyanosis under 2 years of age are at risk of developing this particular cyanotic spell. It usually occurs following awakening from sleep or following excessive crying. Well, increased dysaturation of the blood in the systemic circulation presents as increased degree of cyanosis. Hypoxia and metabolic acidosis complicates the organ dysfunction. Sometimes cardiac dysfunction resulting in circulatory collapse and death. And hypoxia to the that is cerebral hypoxia can lead to convulsions, gradual loss of consciousness, sometimes hemiplegia. Okay. And sometimes the hypoxic injury to the brain could be permanent, resulting in death. Well, coming to the clinical presentations. As I told you, this particular situation occurs in paroxysms. Onset is unpredictable, usually follows excessive crying or following feeding. And child suddenly develops restlessness, tachycardia, tachypnea, increased cyanosis, and lose consciousness. This episode may last few minutes, sometimes may last hours. Generalized weakness follows attack and the child goes into sleep. In severe spells, the patient may lose consciousness, develop convulsions. When you examine the child will be in respiratory distress with tachypnea. There will be deep cyanosis, maybe gasping. When you auscultate the heart, second heart sound is diminished in intensity and decreased intensity of the systolic murmur. Okay. And in severe cases, patient may be in coma with neurological deficit. How do you manage? As I told you, this is a medical emergency. And keep the patient in the elbow position, administer oxygen, inject morphine 0.2 milligrams per kilo body weight subcutaneously, monitor the clinical status, and do the ABGs. If PaO2 is less than 40 mmHg, give bicarbonate. Once the pH is corrected, most of the children improve. Okay. The main line of management is to counter the peripheral vasoconstriction. Okay. And improve the pulmonary circulation by reducing the pulmonary vasoconstriction. This can be brought about by keeping the patient in the elbow position, will increase the peripheral vascular resistance and increase the venous return because of the pressure over the femoral veins. And by injecting the morphine, it's going to cause the relaxation of the right ventricular outflow tract, thereby improving the pulmonary circulation. The oxygen administration is going to cause the pulmonary vasodilatation, thereby causing the increased pulmonary blood flow. Okay. It also results in the peripheral vasoconstriction, resulting in the increased vascular resistance. Once these two parameters are corrected, that is, increasing the peripheral vascular resistance and decreasing the pulmonary vascular resistance, will result in the improved pulmonary circulation and reduction in the right to left shunt at the ventricular septal level. Okay. This will improve the clinical situation of the patient in hypoxic spell. Once child is improved, you can advise the patient to continue propranolol 0.2 milligrams per kg body weight and give the counseling in order to undergo the total correction of tetralogy Fallots. Until that time, advocate prophylaxis for subacute bacterial endocarditis. Well, this is the line of management of a child with cyanotic spell. Thank you very much for patient listening. We'll meet again in the next class. Until that time, bye-bye. Thank you. Well, most of the children with tetralogy Fallots should be advised to undergo surgery as early as 1 year of age. And in the current scenario,